Thank God I love pink. When I first felt the lump in my left breast, I ignored it, thinking that I'd have my doctor look at it during my next annual physical coming up in just a couple of months. But when I woke up one morning with unrelenting back pain that brought me to tears, I found myself at the doctor's office to try to treat it a few days later. And I also thought I'd have him check out the lump while I was there and kill two birds with one stone, so to speak. I never expected him to send me for a mammogram at the age of 29, nor did I expect the biopsy that followed a few days later. The day after my biopsy, my phone rang. The pathologist on the other line said a key word that broke the dam that held back my tears. Unfortunately. I already knew what the next two words would be and almost whispered them with her. It's cancer. I tried very hard to listen to her and ask questions so I knew what to do next. But all I could think of was, I'm dying. This is it. I'm too young for all of this. Why me? I used to think breasts were mere ornaments and milk factories, but now they were like leeches, sucking the life out of me. Get them off of me. Throw them away. Let me live, I thought. Now, instead of these once beautiful appendages, I'm left with scars that tell a story of my battle with breast cancer. What's more, these scars are proof positive that I'm also a fighter, a warrior, and now a survivor. But I didn't always feel that way. When I heard the devastating news, I felt the blood drain from my face. I felt like it was the end. I'd watched loved ones fight cancer and unfortunately lose their battles with it. I just knew I was next. I met with my surgical oncologist within the next week, and she told me with confidence, I've got this. Our first step was a lymphadenectomy, which is a lymph node dissection and removal to see how many of my lymph nodes were involved and what stage my breast cancer had become. At the same time, she installed a power port in my right side for the chemotherapy sessions that would soon follow. In total, she removed 7 lymph nodes, and 2 of them were positive for cancer cells. One of the side effects of this surgery is lymphedema, which is swelling caused by the excess fluid or lymph as it collects in your tissues. Not everyone who has this surgery will develop this side effect, but unfortunately I did develop lymphedema, and a few months later I underwent several sessions of lymphedema therapy to learn how to manage the swelling and pain. To this day, I still have to be careful about trauma to my left side, including avoiding sunburns, mosquito bites, blood pressure readings, and even regular exercise or heavy lifting because it all can cause the swelling to reoccur. I was also custom fitted with a compression sleeve that I wear as needed. The next step in my journey was scans galore. It almost felt like a rat race, juggling work with all the countless appointments I went through. In the process of all the mammograms, biopsies, scans, and so forth, they determined that I had not only the initial lump that I felt, which was 3.5 centimeters in diameter, but another one deeper in my chest that was 2.5 centimeters. So I basically had a small citrus fruit growing in my breast. Once I knew how extensive the cancer was and the type, stage 3 infiltrating ductal carcinoma, I began my chemotherapy sessions. By the time my 30th birthday arrived in the first week of September of 2014, my hair had already fallen out significantly, so I had a family member shave it down completely. My friends threw me a surprise Mad Hatter themed birthday party and brought several hats for me to wear until it grew back. Being so young and not having any kids just yet, I wanted to protect my fertility, so my oncologist put me on Zoladex shots, which put me in a temporary state of menopause to keep the chemo from attacking my eggs. The needle for the shots was massive. It was about the diameter of a grain of rice, and needless to say, the fear I had of needles as a child would be tested to its limits during all of this. I had typical menopause symptoms, including hot flashes, so those hats, scarves, and wigs were just too hot for me to wear, and I decided to rock the bald look. Thankfully, I didn't hit my head much growing up, so I had a pretty nice looking bald head. My baldness also made me feel bold. I went through several rounds of chemotherapy that took their toll on me. They'd load me up with anti-nausea medicine so I wouldn't get sick, but I still lost my appetite and initially lost about 20 pounds. But when they put me on steroids, my appetite came back swinging, and let's just say I'd heard that a fat cancer patient is better than a skinny one. In addition to losing my hair, my nails turned color and almost fell off. I could hardly sleep. I had trouble remembering things. My hands and feet tingled, and I was extremely exhausted. The day after my chemo sessions, I would return for a shot that increased my white blood cell count so I could fight off the sickness and infections easier. But those shots made me feel like I had the flu and caused every single bone in my body to ache. My chemo was usually on a Wednesday, so I'd take the rest of the week off and be ready for work again on Monday. It was absolutely the toughest battle I'd fought in my entire life. But I owe my survivor status to several factors. One, a support system that has met many needs, kept up my spirits with cards and flowers, and picked up the slack at work in my many absences and prayed for me constantly. Two, an intelligent and talented group of healthcare providers who have used their expertise to rid my body of cancer. And last but not least, a God who tells us to consider the lilies and sparrows, who knows the numbers of hairs, or lack thereof, on our heads. He loves us unconditionally and is the ultimate healer. At one point during my treatment, I took a genetic test to check for the BRCA1 or BRCA2 gene mutations. As it turned out, I have the same gene mutation that Angelina Jolie has, the BRCA1. After the multiple rounds of chemotherapy were finished, I rested for a few weeks before it was time for my double skin-sparing mastectomy, with immediate reconstruction to follow. I could have opted for just a single mastectomy instead, but with the genetic test findings and the initial size of the lumps, remember that citrus fruit I had in there? My surgical oncologist and I agreed that those suckers needed to go. I'd met with a plastic surgeon prior to the surgery who discussed reconstruction options with me. And based on my age and other factors, we decided to go with the expanders to stretch out the tissue and then replace them later with permanent silicone implants once we reached the desired size. This was supposed to be one of the simplest reconstruction surgeries I could have chosen. When I woke up from my surgery, I was bandaged and couldn't see the extent of my incisions. I could barely breathe, and the pain was unimaginable. I had 4 drains coming out of my sides, and I was very limited in my movement. Going into this, I knew that recovery would take a long time, so my mom flew down to Arkansas from Oregon to be with me for a week or two. Unfortunately, I developed a severe infection in my right side and had to have emergency surgery to remove the expander. The same thing happened about a month later to the left side, and I again went under the knife to have it removed. With both of my expanders gone, I was left with 2 large scars on my chest that left me almost with a belly button-like appearance where my breasts used to be. I was fitted for prosthetic breasts that I can insert in my bra so my clothes would fit normally, but seeing myself naked was always really tough. A few months later, during a second attempt at reconstruction, my plastic surgeon placed new expanders under my breast muscles. But within a couple of weeks, I had one replaced and then both removed due to infection once again. My last surgery of 7 was on July 31st of 2015. Soon after, I developed an excruciating and debilitating case of costochondritis, which is pain at the joints where the cartilage and ribs meet. And it lasted for several months and required painful injections and physical therapy to finally heal from the pain. After talking to my doctors, I decided to take an extended break and live my life for a while. Meanwhile, since the chemotherapy had ended, I no longer needed the medicine that put me in menopause. 3 weeks after my final surgery, I found out I was pregnant with my first and possibly only child, who I gave birth to in May 2016. Life has a way of coming full circle. In July 2014, I thought I was going to die, and now I'm responsible for raising a tiny little human. My reconstruction process is still not finished, and since I carry the BRCA1 gene mutation, my oncologist would like me to have my ovaries removed as soon as possible once I decide if my daughter will be my one and only child. But although I have to see the scars all over my chest daily and still wear prosthetics to feel normal again, I'm alive to tell my story, and I will be alive for many years to come now that I'm cancer-free. The fears and memories come back with every new scan I undergo every 6 months, but I've become a warrior over the last 2 years, and I'm ready to face any challenge that comes my way. I wanted to share with you a few things I learned as a cancer survivor. One, always look for the silver lining, even if that means the new gray hairs that start coming in once your hair grows back. 2, people want to feel needed while you're battling cancer. Let them do something for you because, let's face it, you need the help and it will bless them too. Each person's cancer experience is unique, but some of your best resources are people who have been there. Prayer and faith works. If you're young, expect to be surrounded by people your grandparents' age at every oncology appointment, but cherish the memories they tell and don't flinch when they call you kid. The cancer your parents and grandparents had the treatment for is not the same. Thanks to research and advances in medicine that have made treating cancer so much better than it was even 15 years ago when my grandmothers lost their battles. You can expect to talk openly about your bowels. We've all been there one way or another. Learn to be flexible when it comes to the treatment plan. Getting from point A to point B sounds great in theory, but in practice, we all know there's a few other points along the way. There's a reason we're called patients. Find a reason to celebrate all the little things. Is it your last day of chemo? Eat cupcakes. Felt the wind blow through your hair for the first time? Eat another cupcake. Didn't tense up during a port access? High five. You're going to have a mastectomy in the morning? Why not celebrate with a beau voyage like I did? If you forget a birthday, a meeting, or how to pump your own gas, blame it on chemo brain. You've earned that right, haven't you? Cancer may be the biggest fight of your life, but you're not alone in the battle. God is with you always. One last thing, embrace the color of your ribbon. Although cancer doesn't define you, it will become your battle flag. Thank God I love pink.